While some kids can get the COVID-19 vaccine without their parents' consent, state lawmakers say that needs to change.
Yeah, there's a bill that's moving forward today, and it addresses this issue, but critics say the state should not make it any harder to get the vaccine. Capitol reporter Michael Hyland is live in Raleigh for us tonight. Michael, most states already require parental consent for the vaccine now.
Right, and here in North Carolina, some vaccine providers also require consent. But state law says that kids under 18 do have the right to make certain health care decisions for themselves, and one of them is whether to get the COVID-19 vaccine. Now that kids 12 and up are eligible for the COVID-19 vaccine, Republican Senator Jim Bergen says he's heard a concern from some parents.
I think that people need to know what their kids are going to be getting, even if they're 16.
State law allows for minors to get the vaccine without parental consent. Bergen is sponsoring a bill to change that, saying that kids under 18 need written consent from a parent or guardian to get a vaccine authorized under an emergency use, which is the case for the COVID-19 vaccine. Is the intent of this in any way to make people think that the vaccine is unsafe?
Not at all, not at all. And I encourage folks to get vaccines. I was talking to folks yesterday. We've seen an uptick in the number of people that are hospitalized.
The Kaiser Family Foundation says 41 states require parental consent for kids to get the COVID-19 vaccine. North Carolina is among a handful that apply what's called the mature minor doctrine. Elizabeth Ramsey at UNC Health recently told us that means healthcare providers make an assessment about a minor's capacity to make these decisions.
As long as they show that they have clear decision-making ability, then we'll allow them to consent.
The Department of Health and Human Services says they expect in most cases teens are getting their parents' permission. Democratic Senator Wiley Nichols says with rising cases and vaccinations slowing, he doesn't think this bill is the right step.
I think the state ought to be doing everything we can to make it easier to get a vaccine, not harder.
This bill would not apply to any vaccines that have full approval by the FDA. Just last night, President Biden said he thinks that could happen with the COVID-19 vaccines as soon as this fall. Live in Raleigh, Michael Hyland, CBS 17 News.
Very interesting discussion, Michael. Thank you.
And we'd like to hear from you now. Should healthcare workers be required to get the vaccine? And